Great. Good afternoon, everybody, and welcome. Welcome to this press conference of Friday, the 19th of 2021. Just a reminder, if you would, to stay on mute, and of course a reminder that today's meeting is being recorded. With apologies from Councillor Ian Morris, who can't be with us today. Line up today is our speakers. We're glad to have with us Lucy Whiteman, Director of Public Health, Deborah Needham, the Chief Executive of Northampton General Hospital, Chris Pallow, who's the Programme Director for Vaccination, and Assistant Chief Constable Simon. Also present, we have Paul Andrews, representing the COVID school cell. Councillor Tom Beattie is the leader of Corby Borough Council, and Councillor Leslie Thurland is the Deputy Leader of Kettering Borough Council. Welcome to everybody. Lucy, over to you initially.
Thank you, Councillor Nan, and good afternoon, everybody. Welcome to the press conference on Friday afternoon, as always. We obviously have produced our normal surveillance report, which hopefully will be coming up on the screen any minute now. Here we go. So standard format, I'm sure people are very familiar with this now, but headlines from this week, obviously just trying to reinforce the fact that we continue to be in a national lockdown. And I think it's really important that people do remember, although the government is due to publish a route out of lockdown on Monday next week, it is, there will be dates that are associated with that. And despite that publication, we are highly likely to be staying in a set of restrictions for some time yet. So that publication, we must be very careful about the dates that are cited there and continue to adhere to the rules as outlined. And that's because lockdown at this point in time, it continues to be working both across the country with a continued reduction in cases, but also thankfully in Northamptonshire as well. So a total of 1,342 cases reported in the week up to the 14th of February. Again, we still see that transmission when we're speaking to people about their contacts happening between household members and then between households. So still some deviation from the rules there, and people really need to make sure that in this last few weeks that we continue to stick to those strict rules to make sure that our recovery is as good as possible once that route out of lockdown is outlined. So again, two quick reminders that the vaccination, good news as it is only the beginning of a very, very long programme. One vaccination does not make you, resistant to COVID in and of itself, and you do still pose a risk to other people because you can still carry the virus despite having a vaccine. So please do remember that even if you've had a dose of the vaccine, it is not a green card to go and do as you please. You are still subject to the restrictions, and you do not have, a good enough coverage until you've had both vaccinations, and that will be some weeks yet to come. So please continue to adhere to the rules. Similarly, for those that are being tested regularly, and particularly those who are accessing lateral flow device testing, again, it doesn't give you a green card to go and do what you want. It is simply a test to tell you whether you are posing a risk to your co-workers on that day. You are still subject, as same as everybody else, to the current legislation and lockdown rules. So if we go down to the first data page, please. So, good news, as I said, we continue to progress slowly, and we had 1,342 cases in the week up to the 14th of February. So good news, and you can see from the bar chart that we continue on that slow but steady downward trajectory. If we go on to the next slide. We do still have significant variation across our county though, extraordinary progress made in South Northamptonshire at 85.7 cases per 100,000 as a rolling 7-day average. But, a significant difference to areas such as Corby at 347.6. I'm pleased to say that actually today's data shows that down further. Kettering as well at 259.4 still remains statistically significantly higher than both the county average and the England average, with Wellingborough also obviously slightly there above the England average, as well as Northampton. So good progress, but certainly not a point where we can be complacent at all. And I know we say that every week, but this is the last few weeks now of significant restrictions, we would hope. And if people do daft things now, we're likely to see restrictions stay in place longer, and I'm sure that's something none of us do want to have to be subject to. If we go down again. So good news, as I said, decrease. This is the actual numbers. So you can see much smaller numbers across the piece. And I just have to obviously as well celebrate Northampton, you know, one of our most densely populated, one of our most deprived areas, with consistently pretty much the highest rate in Northamptonshire, and at times even, as we know, again in the country. And the case rate and the numbers here really significantly coming down. So again, it just demonstrates what can be done when people adhere to the rules. So I just really wanted to pull that out as one of the really, really strong examples of communities coming together and finding that you know, that adherence to those strict regulations is paying off. If we go down again. So good news, obviously we've talked before about all of the bars that go under the 0 mark mean that we've seen a reduction in cases. But what we will see obviously is the last few days we've seen just a reduction in the speed of that decline. But it is still really good news, something that we should celebrate, and certainly an improvement since the beginning of February. So let's keep on going for these last few weeks and make sure that we continue on this downward trend. The next slide. So that's just the illustration, as always, of where we are in each borough and district. If we go down again. So again, we've got that 30 to 39-year-old really sort of heavily affected group. Now, we do recognise this as a working age population. We do recognise this is an age group that's likely to have caring responsibility both for younger children and older parents perhaps, but we've got that stubbornly high case rate in that age group. So really encouraging people to use some of the lateral flow device testing centres for those people that do have to attend work. We've now got 3 in the county. There is obviously the 2 that we've had now for some weeks at Lodge Park Sports Centre in Corby and the University of Northampton Waterside campus, but we've now introduced a third site in Danes Camp Leisure Centre in Northampton, again in and around the area where we see a lot of industrial and manual workers still having to present at work. So a focused, targeted support for those people who are travelling into work, but really encouraging this working age group to go and get tested on a regular basis. That lateral flow device test does provide you with some insight as to your level of infectivity if you have COVID. But as I said before, it's not a green card to then go and do as you wish. It's about protecting you and your work colleagues. If we go on to the next slide. And, you know, one of the benefits, obviously, of having a reduction in case rates, particularly in the over 60s, which we're continuing to see as well, is the fact that we are slowly seeing that mortality rate come down. The only area that didn't see a change last week was Daventry, and that's obviously because they didn't have any deaths, which obviously is exceptional news. And we want to make sure that we get all of our other boroughs and districts back into that position as well. But broadly good news, as in we are moving slowly away from seeing more and more deaths, but still, you know, a tragedy for 34 families affected by COVID-19 in the worst possible way in that week. If we move on. So we've got echoes there of our over 65 case rate coming down, and that translates into a reduction in the number of beds occupied. Again, really, really good news, but we are still seeing demand for our intensive care beds where people have got that longer length of stay. So we're still a while away from having all of our business as usual services back up and running, but still really good progress. Next slide, please. If we go down to our outbreaks page. So again, positive news, 28 current active outbreaks that we're managing, again, still spread across each area. So no area is immune. You can even see South Northants with their low case rate still does get affected. Again, care homes, care settings are being proactively swabbed, so we would expect to see the lion's share of cases there and outbreaks. And thankfully, we've had a small number now in the workplace environment as well, but you can still see we do have a concentration there of outbreaks in Corby, which we continue to support, but similarly in similar numbers in Wellingborough and obviously Kettering as well. So continued work with environmental health officers, Health and Safety Executive and Public Health England, to all of whom I'm very grateful for their continued support around ensuring our businesses and our workplace settings are as safe as possible under the circumstances. So if I just stop there, Councillor, and hand over to the next speaker.
Thank you, Lucy. Thank you very much indeed. Very helpful. Next speaker is Deborah, Chief Executive of the... Deborah, welcome. Over to you.
Thank you very much, Councillor. So I think it's fair to say that the past 12 months have been the toughest period the NHS has faced. We wouldn't have got through it without the fantastic support from our public, but we've got to have that support continuing. We can't afford to drop our guard at any point. We must continue to stick to the rules. So just to remind everybody, that's good hand hygiene, wearing a mask or a face covering, and ensuring that we are at least 2 metres apart from each other. This especially applies when you're in either one of our hospitals. And if you're not wearing a mask or a face covering or appropriate PPE, you should expect that my staff will respectfully challenge you. So we know that some people are exempt from wearing masks, but that's only if they have a valid reason, such as children under 11 or because of a physical condition, or if wearing a mask causes you some sort of distress. But unfortunately, we have had recent cases where patients or their relatives who've been accompanying them have acted quite aggressively when challenged by our staff. So my message today to the public in Northamptonshire is please respect our staff. They've got a duty to protect all of our patients and each other from any unnecessary risk. So it's right that I'm advising them to make these challenges and ask that you wear a mask if you're able to do so. So reacting in a way that makes our staff feel threatened is not going to be tolerated. I will not tolerate that as the chief exec of this organisation, and we will be asking you to leave our premises if you do react in an aggressive way to our staff. Moving on then to the cases, we've just heard that whilst some areas are reducing, cases still remain high in our community, and that's still reflected in the numbers of patients within our hospital. But we are starting to see the numbers decline even further from when we talked last week. It's really good news, but as Lucy said, the number of very poorly patients who are receiving critical care means that that number is still quite high, so it means that we're still really quite busy in both acute hospitals. Our staff are continuing to do an amazing job day in, day out. They work tirelessly to provide just amazing care every day for all of our patients. And I just want to thank them and pay tribute to them for everything that they're doing, and of course continue to do in such challenging circumstances. So in terms of the numbers, at the peak of this latest wave, both our two hospitals were caring for 411 patients in total. This has now more than halved, and we've got 178 patients currently in both of our hospitals who are COVID positive. So although we are still quite busy, we're starting to plan how we resume some more of our activity. Colleagues and the public will know that we've had to take down some non-urgent activity over the last few months. That was suspended whilst we focus on our most urgent cases. So good news for everybody that we are now starting to plan how we resume some of that work. So that's it for me today. Thank you very much.
Deborah, thank you very much indeed. It's very informative. I know that everyone will be really disappointed to hear that your staff aren't treated with respect. And please know that everybody here, and for us who are politicians representing residents, we pass enormous thanks back to everybody, and we're grateful for everything they're doing, to some extent the risk they're taking to look after all of us. Next, it's an update on the vaccination rollout, for which we go over to the programme director, and that's Chris Pallett. Chris, welcome.
Thank you very much. Good afternoon, everybody. Good afternoon, Councillor, and thank you very much. So the latest figures for the vaccination programme in Northamptonshire are that we've now delivered 168,000 doses of the vaccine to members of our community. 158,000 of those are first doses, showing that we're now expanding the programme as very well indeed. In terms of the penetration into the various cohorts, in the over 80s, we've delivered the vaccination to 95% of our residents. For the over 75s, that rises to 99%. And for the over 70s, it is 93%. And we continue to focus on those remaining patients in those cohorts. And my message is that if, for whatever reason, members of those age groups have not come forward, or maybe unlikely, I hope, but maybe haven't heard from the NHS so far, please do get in touch with us. You can ring 119 to book an appointment. You can do that online through the NHS website. And of course, if you wish, you could also contact your general practitioner. We're now focusing on cohorts 5 and 6 particularly. And the cohort 5 is those who are aged over 65, and cohort 6 are those who are at moderate risk if they were to contract COVID-19. General practice in particular is focusing on those in cohort 6, and our colleagues in primary care are doing a wonderful job of calling those patients forward for their vaccination. If you haven't heard yet, please do bear with us. You will hear, but it's a large cohort that we're seeking to take care of. And so it's just going to take us a little time to get through everybody that needs to. We do have slots this weekend in the vaccination centre. So as I've said, if you haven't heard from us and you're in the cohorts that I've mentioned, please do come forward, because we'll be able to vaccinate you without delay. We're also focusing very heavily on improving uptake in our BAME community. We know nationally that there are slightly lower uptakes within those members of our community, and that's something that we're working hard with community and faith leaders within Northamptonshire to improve uptake and ensure that we can listen to members of those communities as to any suggestions that they may have for us to improve the vaccination rates for those people. We're also continuing to focus on care homes. There are 128 care homes in Northamptonshire which care for the over 65s and which were offered the vaccination where appropriate so far in cohorts 1 to 4. We continue, of course, to visit those care homes because some have had outbreaks and we weren't able to visit before. And of course, the throughput means that we have to have a rolling programme to ensure that as new patients arrive, we're able to offer them a service. Within cohort 6, we're now starting to focus as well on all the remaining cohorts, those who might care for younger adults or others with other special needs. And that's going to be the feature of our programme, or one feature of our programme, going forward in the coming weeks. So I'll pause there, Councillor Nunn, and hand over.
Thank you, Chris. That's very informative. Then finally, we go to Assistant Chief Constable Simon Blatchley. Simon, over to you.
Thank you, Councillor, and good afternoon, everyone. From a policing perspective, obviously our role is to support the excellent work that's going on with our health partners. We've not seen any sort of large mass gatherings or unlicensed music events or very similar. What we are still seeing, unfortunately, and we are still enforcing, is the travelling outside without reasonable excuse, gatherings of more than 2 people, gathering in public place, and then some still not wearing a face mask where people should be. So the strong message still is please follow the rules. Only go outside those essential journeys only. Please don't mix families, don't mix with friends. You know, we've got some really positive news in the county in this another few weeks, hopefully. Keep pushing, following the rules, and we can beat this. As a police service, we're supporting our partners. We are enforcing. These breaches I've mentioned are generally across the county that we've seen. We'll continue our patrols, as well as targeting areas where we get reports from the public. The most common calls we get from members of the public when they phone our control room are these sort of neighbours with gatherings and those sort of people gathering in outside places in what seems to be large numbers, and we attend where we can. So that's where we are at the moment. Thank you, Councillor.
Thank you, Simon. Thank you. That's very helpful. Let's move to our questions now. First, we have Matt Harris from Northants Live. Are you with us, Matt? Yes, I think you are.
Oh, 1 second, sorry. Yes, my first question is, has the South African COVID variant been detected in Northampton?
Lucy, this one I think you might comment on, but it crops up often, and I think it's fair to say there's quite a significant process, so people will be made aware when these particular strains come along, won't they? Sorry.
Yeah, absolutely, absolutely. So the answer to your question is no. We have not had any of the South African variant, and indeed, you as our press partners would be very much made aware, and very early if that were the case, because as you would have seen in other parts of the country, we are required to have a local plan and that is for significant surge testing that is approximately 10,000 households around any South African variant case. It is not associated with travel. And therefore, actually, we'd be very reliant on our press partners to help us get that message out to that community that may be affected, and obviously to hopefully help us increase uptake of that surge testing as required. So no, the answer at this point in time is, touching wood, we have not had that variant identified here. We do have plans in place to make sure that we can surge test as required should that be identified. And we absolutely would be telling the press really early on in that process, because we would very much be wanting you to help us make sure that that surge testing was successful.
I understand, thank you. And how many people have been invited to take up the COVID vaccine, and how many have not taken up that offer in Northamptonshire?
Some of that covered already, Chris. Anything you'd like to add?
No, it's a similar answer. We had quite a very similar question last week. And the answer, Matt, is that everyone in the cohorts 1 to 4 have been offered the vaccine, very much in the way that you heard me say a minute ago, which is, if you haven't heard them, please come forward, because now's the time to do so. In terms, we don't know how many people have declined that. All we can tell you is the percentage that we have vaccinated within that cohort, and those are the figures that I gave.
Okay, I understand. And one final question. How have the extra police patrols gone in Corby and Kettering, and what anecdotally have officers had to deal with in those two towns?
Thank you. Yeah, much as I was saying earlier, really, we have seen a marginal increase in what we could call antisocial behaviour, use being reported in skate parks, things like that. Where possible, we've attended advice. We've seen an increase in where we've taken some children home, and then letters have then been sent to parents. Then we've given parents suitable advice as well. But generally, as I was saying at the beginning, it is the usual. It's the usual issues that are coming up. People being outside and gathering in groups when they don't need to, and people having too many people in their houses, and that's sort of been the common theme for the last few weeks, whether it's been sort of half term or not. And I appreciate a lot of this is probably just some fatigue with the lockdown, but it is just encouraging people to please follow the rules. Thank you.
I understand. Thanks, guys.
Thanks, Simon. Thank you, Matt, for your questions. Next question is from Emma Bohr. Emma, I don't know if you want to ask the question. Are you with us?
Emma's not, but I'm here
Oh,
from Lucky, so I can stand in for Emma if that's okay. Yeah, so just the question we submitted in advance, which was, what data can you provide us, or what information can you provide us about the lateral flow tests that are being used? How many cases are those lateral flow tests picking up? And then can I just ask a second question, which is, the government, as loosely referred to, is going to set out this roadmap next week. How can a roadmap work for Northamptonshire? How can the same plan work for Northamptonshire, covering both Corby with the highest rates in the country and South Northamptonshire with comparatively very low rates? How is it possible that a roadmap might set out a system that works for both of those places?
Lucy, do you want to start on that?
Yeah, absolutely. So lateral flow test figures, I haven't got it split out by site, but I can tell you how many we've done across what was 2 sites. So in the first week they were open, we did 1,153 tests, and there was a 1% positivity. The second week we did 1,848 tests, and there was a 1.9% positivity. The last full week that we had 2,653 tests across the 2 sites, and there was a 2.1% positivity. And we've only got partial, obviously, because we're halfway through that 4th week with having 3 sites open. So you can see that obviously we've got a steady increase in case numbers going through there, which is really, really good news. We want people to be utilising these resources. And the national average for lateral flow device testing is 2%. So you can see even with the Corby effect and you know, the case rates being so high there, we're still well within the kind of average expectation of lateral flow device testing positivity. So it is being used to help identify high risk individuals and making sure they isolate, but it's certainly not identifying a huge swathe of asymptomatic people, you know, even in Corby. So it's one of the many tools we have to continue to use. And you sneaked in a question there again about the different impact or effect and approaches that a single route out might have for areas that have got statistically significantly different case rates. And I'll be honest, it's one of the things that I am sort of pondering myself. We don't have any detail of that current route out at the moment. What we are anticipating is that it won't be geographically specific. So we are expecting a plan that says everybody does the same thing at the same time. But obviously, I have always said that we know with Corby's case rate being so high that they may have to consider different measures if we don't continue to demonstrate good progress. I think one of the things that we've got to be aware of is that the government have reflected on their previous release of lockdown, and I think we will see this one be much slower, so that we understand the impact of each sector being reopened. And therefore we may then find, if we see significant spikes that are geographic rather than sector specific, that the government has to review what kind of action they would take. And indeed, obviously local environmental health teams and directors of public health have powers where they can obviously restrict certain activities as well, should they find or feel that any of those particular issues are playing out and causing an increased risk in particular areas. But I wait, the same as everybody else, with bated breath to see what that route looks like out of lockdown, and I'm sure we'll be talking more about that next week.
Just one very quick final, I know I'm being a bit cheeky here, on lateral flow tests. You laid out some very detailed stats there, and that's very useful, thank you. I know in previous weeks you've talked about the downsides of these tests as well as the plus side. When you look at those statistics, do those statistics suggest a system that is working for you, that is worthwhile?
It's a good question, and I think there's similar questions later on in the tabled questions as well. At this point in time, to me, it is suggesting that yes, it's adding value to those people that it's targeting. So, you know, we have not opened this out like they did in Liverpool to everybody. This is very much targeted at people who are key workers who have to attend work because they cannot physically work from home. So people who work in, you know, industrial and manual labour type roles, and some of those areas that we've talked about as being more high risk, you know, as highlighted in recent weeks by conversations with Councillor Beattie in the Cabinet Office, etc., about population level risk. So I think it is providing a tool in a bigger toolkit that provides people with assurance and insight. So, you know, we clearly have picked up positives through that process that otherwise potentially would not have gone for testing. That is a good thing. I think what it has proved is that at this point in time, Corby in particular, or Kettering with their higher rates, are not demonstrating that they're picking up a significantly higher rate of positivity than other areas. And therefore, I think although we need this as part of our toolkit, the requirement for further or significant, you know, testing facilities in somewhere like Corby or Kettering with higher rates, to me at this point wouldn't add a huge amount of value. But it's something that I have to monitor on a week-by-week basis and have ongoing conversations with Public Health England and the Joint Biosecurity Centre about.
Thank you. Thank you, Lucy. Thanks for your question, Sam. 3 for the price of 1 there, I think. Let's move on to ITV Anglia and Neil Barber. Neil, are you with us? Okay, we'll hold that, maybe come back to Neil if he comes back. Chronicle Echo, Kevin Nichols. Afternoon, Kevin. Do you want to ask your questions?
Afternoon, Jonathan. Yes, I think Lucy may have covered a little bit of mine, just talking about the lateral flow testing centres just now. Yeah, I was a little curious when we heard earlier in the week about the second lateral flow test centre being opened in Northampton. There's been a lot of talk about Corby having the highest infection rate in the country. The local MP called for a mass testing programme. Even the health secretary promised to do something about it, but although it hasn't so far, it just struck us a little odd to then open a lateral flow testing centre 25 miles away on the other side of Northampton. I just wonder if there was any logic behind that.
There's one in Corby, isn't there?
There is one in Corby, but there's now 2 in Northampton.
And that's if you look at the population size and the current positivity rates, it doesn't at this point in time suggest that we need a further testing site in Corby. If we'd seen that the Corby positivity rate was much, much higher, then we would have obviously made sure that there was greater access and that we were trying to reach out to more people. But at this point in time, it's the same as the national average, as is Northampton's. The reason for the second site in Northampton is feedback about the ease of access to Waterside campus, and we're looking at whether having one closer to the industrial work sites and the industrial parks it will be helpful in getting a greater footfall in Northampton, but it's purely just size of population here as well.
Yeah, I was right. You had answered it already. Thank you. May I ask my second one, Jonathan, please?
Yes, please, Kevin.
Thank you. And there was a prominent Tory MP said this week that by the beginning of May, the top 9 groups in the priority cohorts will have been vaccinated, and that's where 99% of deaths occur. So everything should be able to return to normal from that date. I just wonder if anybody has any views on that, whether they would agree with that as a realistic assessment.
Let's start. Lucy's answered the last few. I thought Tom may want to comment on this. Tom, do you want to start us off on this one? Oh, I think you're still on mute, Tom.
Yeah, sorry about that. Yeah, thanks, Jonathan. Throughout the pandemic, I've always been pretty clear that of the importance of, as it were, following the science and listening to the experts. I prefer to listen to public health experts. I prefer to listen to, people like Professor Chris Whitty and others than any prominent Conservative or indeed Labour MP. I'm not making a party political point here. It's just that an MP may well have a view that we can get back to normal by that date. I think we need to get back to normal as soon as we can, clearly. But we need to get back to what approaches normality in as safe a fashion as possible. And I think anything premature in respect of that risks our ability to get back to normality. So I'll continue, I think, to listen to the advice and follow the guidance of people like Lucy Whiteman and her colleagues in public health and the health professionals, both at a national and regional level. Thanks, Jonathan.
Yeah, thanks, Tom. And I think I'd be inclined to agree with you. The absolute exact time to get back to normal is when it's safe to do so, isn't it, really? And it's harder to apply that to a calendar. I think it depends very much on behaviour, human behaviour. And there are no guarantees on that. And indeed, the behaviour of the virus, where we see these new strains appearing and so on. And it's very hard to give a predictable date on with something that is so unpredictable and that we're learning more and more about as we go along. Does anybody want to add anything further? Is there a sort of professional health view on that question, or should we move on to the next? Let's move on.
Councillor Nunn, can I just add one thing? I think, we need to reinforce the fact that the vaccine is not in and of itself a silver bullet here. It is one of a number of things that we will continue to need to do. And it is not 100% effective, even when you've had both doses with everybody. So I think, as you say, we need to be led by the data here. And we need to understand what the balance of risk is for different age groups. And you will still find, as we have done before, that even people who are younger and don't have predisposing conditions can still catch COVID and can still sadly die. So, we have to make sure that we're balancing off risk, and we have to make sure that people understand that vaccine in and of itself is not the answer to everything. And I am confident that we will continue to see a number of measures still required even after we are well into the vaccine programme around face covering, social distancing and such like.
Thank you, Lucy. Yeah, thank you. Those are helpful comments to add. Thank you very much. Okay, let's move on. Next, we have Alistair Ulk. Alistair, are you with us?
Sorry, Alistair's not here, but am I okay to ask his question on his behalf? Thanks. Yeah, I think it's One for Chris mainly. Obviously, the vaccine rollout has been really well received here and rolled out well. But I think there's an estimated over 1 million jabs still to be delivered, as well as potential boosters in the autumn. Just kind of wondered how big of a challenge this was for the county, and whether it's a bigger challenge than the initial rollout, and also whether there's long-term plans in place to ensure that there are enough people to continue to deliver these jabs.
Chris?
Yeah, thank you very much. So it's an excellent question, and clearly this vaccination programme is one of the largest that the NHS has implemented, and it is a big logistical challenge. I'm absolutely confident that we have got the human resource and the physical capacity in place to deliver not just down to cohorts 1 to 9 in early May, but to carry on through the cohorts through the summer. Of course, as with everything, and as the Prime Minister has said, this is dependent on the vaccine supply as well, but I'm absolutely confident that will be in place to enable us to continue. I can't possibly comment at the moment about boosters or variant vaccines because the science simply isn't there yet. But it is a large challenge, and we are putting plans in place that go through the spring and the summer to ensure that we vaccinate down through all of the cohorts that we're going to need to do to meet the promises that have been made on behalf of the nation as well as on behalf of Northamptonshire.
Thank you, Chris. Thank you very much, Carly, for the question. Next, we've Laura Coffey from Radio Northampton. Laura, are you with us?
Yeah, good afternoon, Councillor. And so firstly, it's half term at the moment. As far as you're aware, how have people been sticking to the rules? And I just had a couple of additional ones. In the press release this afternoon, it says that there's an additional reminder being issued that gathering in groups is not allowed, whatever a person's age or hobby. I think this was touched on earlier in the press conference, but are there any specific examples? I know it was talked about in skate parks and people gathering there, but are there specific examples that you're referring to in that? And also, how are you dealing with COVID fatigue in getting these vital messages out?
Simon, over to you, I think.
Yes, I think I've probably covered a lot of this one already. Yes, we've had examples across the county, really. I think as I've already said, with reports from the public generally of gathering of children. Obviously, it's half term, and then when we have spoken to them, where appropriate, we've then taken them home. So I can't give you a specific example. It's just a common theme, really, of gathering of children in outdoor spaces. Where possible, we advise, and we're taking them home. And apart from that, it's the same message I've said before. It is that gathering outside and people gathering in too great a number when they shouldn't be, and they're not within their bubble. I don't have any other particular that. The fatigue side, I think the way there is, I would have said part of that is the press conference we're having today. It's the continual messages that we're trying to put out there, both on the health and policing side, to just keep going. But I'll hand back to the councillor.
Thank you. Thank you very much, Simon. We've got next global media, and as we often do, they prefer us. They're not normally represented, I think, so we read their questions. First one they're asking to Lucy. I think we've covered this one actually. How many people daily, weekly are using lateral flow test centres in Northants? Not much to add to that, Lucy, is there?
No.
Okay. The next one again is to you, Lucy. As more areas are now subject to surge testing, do you think this is more or less likely in Corby, and is it desirable for the town? Comment on that one?
I think we've covered that one as well, to be honest. We've talked about, I guess we probably have, at this point in time, there's no rationale for greater surge testing, but if we found a variant and or if the positivity rate went up, we would obviously reconsider that.
Corby specific, you've nothing to add, Tom, on that one?
No, Jonathan, I think Lucy has been quite clear. Obviously, if circumstances change, then I'm happy with the answer that Lucy gave previously.
Yeah, brilliant. Okay, thank you. So the last question from Global Media: with the new extended list of people who need a shield, how many people is this in Northants, and what impact, either positive or negative, is that expected to have on health services? initially, should we start, perhaps Lucy, would you comment on that for us?
Yeah, of course. So in Northamptonshire, it's 9,997 people is what we think is going to be affected in that new cohort. So, 10,000 people, it's not an insignificant additional swathe. How they're affected is that they will now be eligible for vaccination earlier than they potentially would have been under other categorisations. They will be eligible for statutory sick pay because they are being asked wherever possible to not be attending their workplace, and if they can't get to work from home, then they would be eligible for statutory sick pay. They'd also be eligible for priority online shopping slots to ensure that they can have food deliveries, and also support with regard to accessing any medication that they may need. So further information about all of the support services that are available are of course on Northamptonshire County Council website as always, but you will be contacted by the NHS with regards to your vaccination. Chris, I don't know if there's anything you want to add to that.
Thank you, Lucy. The only thing I would add is the question is what impact will that have? From a vaccination perspective, clearly we are anticipating vaccinating patients in that cohort anyway, as being over the age of 18. Of course, we'll be doing them slightly earlier, but I don't anticipate it having a significant impact on the programme at all. And we'll be calling those patients forward as soon as we can and upon receipt of the letters that Lucy's mentioned.
Okay, thank you. Thank you very much indeed. Let's move on then. Kate Cronin, Northampton Telegraph. Kate, are you with us? Some of the question I think has been covered, but
Hello, Jonathan. Sorry, yes. Kate's not with us at the moment, but I'm asking her question instead, if that's all right.
Okay, please.
Okay, so Corby still has the highest rate in the country, despite the many interventions that have been put in place in the town. Can the police representative please tell us how many fines have been issued in the town out of the total in Northamptonshire in the past few weeks, and what kinds of breaches are they typically seeing in Corby? And also last week there was an 8-page leaflet that was launched and put through letterboxes in Corby houses. What other measures are you considering to do to get the numbers down in the town?
Okay. Some of that covered, Simon, I think, but did you want to add anything?
Yeah, I can cover off. I think I've covered a lot of that. From a policing perspective, the reason for the high rate, I think Lucy's covered previously, the areas and the causes of that we believe. The policing perspective, just to give a quick look back over the 4 weeks, 97 fixed penalty notices have been issued in the Corby area, particular increase in the last couple of weeks. That's about between 15-20% of tickets we've issued overall. We've had the increase of patrols there with our joint enforcement team, partners and marshals and wardens. I wouldn't be too sort of hung up on how many tickets are issued, because a lot of this is about the communication. It's also about the effect that just having high profile patrols can have in any given area, about preventing some of the breaches as well. The top ones are still the gatherings I've already said. So groups gathering outdoors, people inside in people's houses, and then sort of the third one is the wearing of face coverings. Thank you.
Thank you, Simon. Thank you very much indeed. Okay, I've just noticed we have got ITV Anglia on the screen. I think we skipped Neil Barker's question because we weren't sure Neil was there. Are you with us, Neil? Anybody ITV Anglia? No? Okay.
Jonathan, I think it was Alison, wasn't it, that asked Kate's question, Alison Bagley?
Hello.
Yeah, okay, sorry, I should have invited you to come in there, Tom. Do you want to add anything?
Yeah, I mean, she did make reference to the 8-page booklet which has been distributed in Corby this week. In fact, I've got a copy of it here. It came through my own letterbox this morning. So that's one of the things that we're doing to try and drive down the unacceptably high levels. That's about advice. It has been very well received. I mean, alongside that, we continue to push out messages via different methods of communication, via press conferences such as this afternoon, all very helpful in getting those messages about safe behaviour, the social distancing, the hand washing, all of those things, face mask wearing. We have adverts on the radio regularly There are posters up in and around the town. We do have the lateral flow testing centre, which Lucy has already referred to, at Lodge Park Sports Centre, all of which are attempts to try and get on top of that unacceptably high rate that we have here in Corby. I mean, I'm aware that those rates are coming down, and I'm pleased to hear that. And I think what we've heard and what we're acutely aware of, that whilst we may be heading in the right direction, we're not heading there fast enough. And I think that's the worry, that we need to get those figures down quicker than we're currently getting them. But we're heading in the right direction, and I think these sorts of things and the other things that I've talked about will help do that. It's about getting that message across so that people understand what the rules and regulations are, abide by the rules and regulations. And if that happens, then we will do that. We will get the levels down here in Corby, as we're seeing elsewhere, and get them down at a rate which is acceptable, rather than the stubbornly sort of slow decline we're seeing at the moment. So I think there's a number of things in response to Alison's question that we're doing and will continue to do. Thank you, Jonathan.
No, thank you, Tom. That's very helpful. Very helpful. We appear just to have time to go back, and part of the reason I keep seeing if Neil's there for his question is that I was really interested in the subject of the question, which is about the level of take-up amongst BAME communities, because I know there's a great deal of work going on. So I wonder if we just take a moment to explore that. It's about the level of take-up, of the vaccine among the BAME communities. Chris, are you able to expand a little bit more on that and tell us what the situation is?
Yes, Councillor. I mean, it's very much as I said in the main presentation, which is what we have available is the raw data, which is at a higher level than Northamptonshire. But we do know that this is a challenge for us. We know that from talking to faith leaders and to community groups. And so there is a lot of work that we are commencing now to engage with that communities as much as we can. There's communities all across the county. And the message that I'd like to give is we are open to any suggestions that you believe as faith leaders, as community leaders, as members of our community, that you think will help to increase the level of uptake of the vaccine. We've done a lot of work with our communications colleagues around myth busting. We've done a lot of work as well around tailor making a lot of our communications to ensure that we reach as many people as we possibly can. But we know that many of the good ideas will come from you, not necessarily from us. And so the message is we'll be as flexible as we possibly can to ensure that we can cover as many members of our community as we possibly can. Because I've said it in another forum this morning, COVID doesn't care. It doesn't care where you live. It doesn't care about your background. It just wants to infect as many of us as it possibly can. So it's our duty to ensure that we offer the vaccine to as many people. We're as flexible as we possibly can be in doing that. So please do let us know your thoughts and ideas, and we're open to them as long as we can deliver them, as long as we can get the staff to the right places. Then we're open to anything that will help.
Thank you, Chris. That concludes our questions. Can I just ask if any panel member has anything else that they would like to add? Perhaps they haven't had the opportunity to. No. Paul, welcome.
Hi, thank you, Councillor Nunn. As we've got time, I just thought there's a sort of group of educational specialists that we very, very rarely talk about, and they've been working right throughout this pandemic, and that's the early years specialists. All of our nursery staff, both those staff in maintained nurseries, but also in all the private nurseries, and they've been doing an incredible job, and they've been open all right throughout this, and whilst the schools have been partially closed, they've been fully open. And I think I'd just like to acknowledge publicly the fantastic work that they've all been done, and I guess give others the opportunity to do the same. Thank you, Councillor Nunn.
Yeah, thank you, Paul. Thank you very much for raising that. I think you're absolutely right. Certainly unsung heroes, really, in terms of what's gone on, but continued hard work and commitments. It is appreciated. It's very much appreciated. It's highly valuable. Thank you for reminding us of that. Any further comments at all from any member of our panel? No? Okay, well, thank you, everybody. I think we've heard some positive news in terms of going the right direction from Lucy, from Deborah. I think there's a strong message there about respecting staff and ensuring that you do that in your behaviour, and indeed the wearing of masks when you visit the hospital, and some positives about normal activity, perhaps resuming in due course. Certainly on the vaccine, I mean, we would hugely applaud the great progress that's being made there, which is Chris has outlined. And I think the message from the police there is please continue to comply. We would like you to comply, but you will suffer a penalty if you don't. And that actually is tremendously reassuring. Can I thank all of the panel professionals for giving up their time to keep everybody so well informed, and indeed the media for coming along and for passing the messages out. Thank you very much indeed.
Thank you.